Okay, I think we can get started. Good morning, everyone. Welcome and thank you for joining today's webinar on planning for 988 implementation in Pennsylvania. I'm Gretchen Frank for anyone new to our events joining today. I'm a senior policy analyst at the Council of State Governments Justice Center. I manage the Pennsylvania Stepping Up TA Center, and I'll be moderating today's webinar. The webinar is presented by the Pennsylvania Stepping Up TA Center, which is funded by PCCD, the Pennsylvania Commission on Crime and Delinquency. PCCD has a committee called MAGIC, the Mental Health and Justice Advisory Committee, which is jointly run by OMSAS. I know we have a presenter from OMSAS today, and the TA Center really functions out of input from that committee. So just wanted to quickly thank PCCD for all their support, as well as OMSAS and MAGIC as we begin today's session. And note that we are recording the session so that those who couldn't attend can still view the webinar. We'll share the recording of the webinar to all the participants when available, along with the PowerPoint slides. If you have any questions or thoughts coming up for you as you go along, please feel free at any point to put those in the chat, or you can message me in the chat individually if you prefer to do that, and we'll make sure that those questions get answered. So we're focusing today on the front end of the system after hearing from counties that this is a big area of focus for many of you, and even more so the past year or two, with the goal of reducing the likelihood of justice involvement for people who have mental illnesses and substance use disorders to begin with. Research has shown that local communities that have built really comprehensive crisis systems have seen positive outcomes, including improved access to treatment, fewer days spent in jail, and cost avoidance and savings for both healthcare payers and criminal justice agencies. So this is just a really important area to focus on. We're glad that counties are interested in this. This is also our focus today because July 2022, by which 988 will be the new 3-digit number for the National Suicide Prevention Lifeline, as you all know, is fast approaching and will be a significant change for communities in many ways. And is new and is a confusing area. 988 will connect callers with staff trained to assist individuals experiencing mental health or substance use related emergencies. And with this change comes a really wonderful opportunity to provide improved and equitable care to people experiencing crisis, linking them to services and supports that they need to remain in the community and to flourish there. And increased volume in our crisis and other community services is anticipated. So thorough planning and strategizing and collaboration are really needed to work toward a comprehensive crisis system that's really ready for this change. So today we'll be hearing more about 988 and the planning that's being done at the state level to prepare for this in Pennsylvania, as well as an example of how one area, Philadelphia, is working toward 988 implementation in their community and how they're planning for the impact that it'll have on their own system. So here is the full agenda for today. So after we hear the presentation from OMSAS and from the Philadelphia representatives, we'll have time for a Q&A for all the presenters. But as I said, feel free to ask your questions at any point. And then I'll just share a few resources and upcoming events that might be of interest to this group. So for our speakers today, we'll be hearing first from Dan Trago from OMSAS, the Office of Mental Health and Substance Abuse Services, about, but who will give us a better overall understanding of 988 and perspective on statewide planning. And then we'll hear from Philadelphia's Director of Crisis Services, Dr. Lisa Colton, and Stepping Up Initiative Supervisor Kate Reed, to talk about how Philadelphia is readying its system for 988. And just very quickly, for anyone new to our events, the Council of State Governments Justice Center is a national nonprofit working across all 3 branches of government. We work on a number of different projects, including Stepping Up. And for Stepping Up, we partner with the National Association of Counties and the American Psychiatric Association Foundation. And for anyone not familiar with Stepping Up is a national initiative that seeks to address the over-incarceration of people with serious mental illness and co-occurring substance use disorders in jails, and was really created to help counties in their work around this. Pennsylvania has a TA center that's specific to helping Pennsylvania counties with this work. It's funded by PCCD, as I think I mentioned, and it allows us to provide more targeted TA to counties in this work using Stepping Up's cross systems framework for planning and implementation to create systems level change. And while the Stepping Up measures that we recommend counties focus on collecting or keeping track of or focus at the jail, most of the strategies and solutions to reduce prevalence are really found outside of, but in partnership with the jail, and really require collaboration across all systems, including law enforcement and crisis, courts and community supervision. So by kind of measuring progress at the jail, that can kind of show us how well our systems are working overall in the community to ultimately reduce incarceration for people with mental illness. So I think with that, I can turn it over to Dan. I'm going to stop sharing my screen and hopefully you're able to. Okay, let me know if you're having any issues.
Okay. Everybody see the screen okay? Okay, great. So good morning and thank you for having me. I'm Dan Trego, working with the Office of Mental Health and Substance Abuse Services in the Pennsylvania Department of Human Services. So I just wanted to start here with a little bit of the federal background. I think at this point, most of us are pretty familiar with what 988 is, but it might be a little bit helpful to just kind of take it back one step to better understand kind of our approach as a state, you know, why we're doing what we're doing and kind of how we got here. So the federal legislation was the National Suicide Hotline Designation Act of 2020. And obviously that established 988 as the nationwide number for the NSPL and the Veterans Crisis Line. But it also provided a funding mechanism for states to fund call centers as well as mobile crisis and stabilization centers. And I think this is important to note because when talking about 988, the parallels to 911 always get drawn in, and there are a lot of parallels to be made. Also, the funding mechanism through the 988 surcharge does look very similar to the 911 surcharge that you may see on your phone bills now. But really that extra component of the mobile crisis and stabilization services being included in 988 really differentiates it from 911. So there's this extra kind of service provision component that's tied into 988 that kind of often gets lost in the parallels with 911. So related to this federal legislation, there's an FCC report and order requiring phone service providers to direct all calls to the 988 number to the NSPL by July 16, 2022. And this is important to note because this date is from federal mandate. So regardless of what we do or fail to do as a state or counties or providers, you know, that date is coming and 988 is going live regardless of what we have done or haven't done to that point. So that's something that we're definitely very mindful of in our state planning, that this deadline is fast approaching and that it is fixed. So kind of stepping into one little piece of the text of the federal legislation notes that the surcharge and just kind of speaks to the scope of the federal 988 legislation more broadly, really points out two things. One is the routing of calls. So this is kind of the technical side of things, the backups, the coordination with NSPL. But then it's also, once again, that service provision piece of, they phrase it as acute mental health, crisis outreach, and stabilization services. So to those familiar with the SAMHSA best practice toolkit for crisis services, you may see a parallel here to three of the big tenets in there, which are someone to talk to, someone to respond, and somewhere to go. And I call this out because, one, that is an integral piece, and I don't think it's by accident that, you know, there is that parallel between the best practice toolkit and 988. But I also wanted to call it out because it does really speak to what we, OMSOS as an agency, are aspiring to. We're really not only with 988, but with the continuum of crisis services, we're really aspiring to those standards in the best practice toolkit. So if you want kind of a foreshadowing of where things are developing, not only with 988, but across the crisis system, over the next year to several years, I think the best practice toolkit is a really good place to start because, again, those standards are something that we're really focusing on as an agency, and 988 is going to be a pretty key part of that as well. So I just wanted to walk through a few efforts that we've made on the state level in preparation for 988. These are things both directly related to 988 and also some ancillary things that tie into 988. So the first is a 988 planning grant that we received through Vibrant, which is the national administrator for 988. And through this grant, we started coordinating with the NSPL call centers, gathering data, really looking at their capacity, call answer rates, seeing what we might need to do in preparation for 988. We've been working with an advocacy coalition to bring in some different voices around 988 to really cover, the regulatory side, the service provision side, and also the community side to make sure that, our preparations for 988 are really encompassing all of the stakeholders who are going to be involved and affected by it. And then lastly, we've been working with Thomas Jefferson University in Philadelphia, which provides technical assistance to the NSPL call centers, just again, to make sure that we're all on the same page and that we have a really, really solid coordinated effort, ahead of 988 going live next year. So what's next for this grant is we're going to continue the coordination that we've been working on. We're also going to be assessing public awareness campaigns for different localities in Pennsylvania, just to see really if there are any gaps in how people find out about crisis services in their community, how they access services, and really make sure that we're aware of any gaps or needs there before the public awareness campaign starts, which is slated to start right around when 988 goes live next July. So something else we've been doing is we issued an RFP to counties to provide some CMHSBG COVID supplemental funding to counties. And through these proposals, counties were able to apply for funding for increased staffing, technological needs, even to start up new programs where it was needed. And really what our thought here was we understand and anticipate that there's going to be an increased demand both at the NSPL call centers and for crisis services in the community. So this was kind of our way of getting a little bit of a head start on helping counties get the resources they need and the capacity they need, in the event that there is a pretty sharp spike in demand once 988 goes live. So what's next for this initiative is award performance. We issued award letters at the end of August and beginning of September for nearly all of the applicants who were awarded at this point. So we're looking forward to seeing, how those programs kind of roll out ahead of 988 implementation next year. So we also applied for a grant through CMS, a state planning grant related to community-based mobile crisis services. But while the effort is focused on mobile crisis, obviously that ties into the entire continuum of services. So really we're aspiring for this to be a very comprehensive assessment of the state of crisis services, not just mobile, but in general across the state, and really taking a deep dive into what we might be able to do to enhance those services and enhance coordination between them. So this is everything from looking at reimbursement rates and how we can involve private insurance more, to the Medicaid state plan to see if there are any changes we can make there to facilitate improvements to the crisis system. And really importantly here is this coordination between the NSPL centers and mobile crisis providers, because when somebody calls 988 and that crisis is unable to be resolved on the call, that then will go to dispatch mobile crisis in the community the person's calling from. So it's going to be really important that we have solid coordination between the NSPL call centers and mobile crisis. So that's going to be a big piece of what we're looking at there. And just lastly on this, if and when this happens, stakeholder engagement is going to be a huge part of this too. So, once this kind of comes to fruition, this is something that we will certainly be working with the counties very closely on. So next on this is just waiting for notification of award. That was supposed to be issued September 10th. It's running a little bit late, as these federal grant things sometimes do. So we're just hoping any day now we get some word on this. Another thing you may be familiar with at the county level is the updates to the crisis services regulations. So we've conducted work groups to update our crisis services regulations to finally move past the 1993 draft regulations, really provide clarity to the counties and providers on, what they should be doing, what they need to be doing, and also to really modernize the regulations, because a lot has changed in the field since 1993, and we're keenly aware of that. So we're making sure that we, update this and also put something out there that will stand the test of time, hopefully, for the next 10 to 20 years, because promulgating regulations is not an easy thing in government. So we're really, really making sure that, these are solid and meet the needs of all the stakeholders, and we'll be able to do so for some time. So those are nearly finished. We have one piece of the draft left relating to payment and financial components of it. Then we'll be submitting for legal review, and then it goes to the promulgation process, which again can take some time, but we're still really aspiring to have these largely completed by the end of the year. So there are two more points I want to touch on. One was 911 coordination, and this effort is really in its infancy, but I just wanted to mention that we are, working with our partners at PEMA who administer 911, because we realize that there's going to be some overlap between these two systems. There are going to be calls that come into 911 that would be better served by 988 and vice versa. So we're really just making sure that everybody has a good understanding of each other's systems, and working on ways that we can efficiently route calls, make sure that people are landing on the appropriate service, and then to the point possible, any kind of technology and information sharing. These are two separate systems, so that, may end up being minimal, but we're at least exploring, the possibilities there. So again, this effort's pretty new, so we're just kind of going to see how 988 unravels at the federal level when the public awareness campaign comes down. There's also the geolocation component that the FCC is working on right now. So we're sure that there will be a lot more constructive conversation needed with 911 as we go forward. And then lastly, there's the Pennsylvania 988 legislation, and this may be the most critical part of all of this, because this really establishes the authority. It establishes the surcharge that we all know that crisis services are not terribly well funded, and the funding has been flat for a while. So really working that surcharge into this legislation is key. So we've drafted legislation to suggest to the sponsoring legislators. We've worked with a few potential sponsoring legislators. Happy to report there that both House and Senate, there's bipartisan interest in this, which is always important if you want things to actually proceed through the legislature at any reasonable pace. So right now, that's with the governor's office. We expect it back any day now. Legislature gets back at the end of this month, here in about 2 weeks. So we're hoping that this is taken up pretty quickly, and that there's something, actually on the docket here shortly. So I wanted to close just by addressing a couple questions, maybe preemptively, that you may have, and if not that, then at least to maybe start thinking about some other questions for the Q&A session. So I just want to kind of touch on these few topics here. So the first one, I think the question we get most is what's in the 988 legislation, or how much will the surcharge be? And unfortunately, to both of those questions, we really can't say. And it's not because we don't want to, or we're keeping anything close to the vest. It's just that, as an agency, we can suggest legislation, craft legislation, provide guidance, but ultimately the content to both of these things will be up to the sponsoring legislator. And because all of those things are subject to change, there's not really too much we can say on it until there's something, formally introduced that can go on the Pennsylvania legislature website and pull up that's publicly available. So I mention this because I know there are probably a few questions of, 988 is coming down the pipeline. We're hearing all this stuff from Vibrant. We're tracking all these developments, but we're not hearing a whole lot from the state. And this may be a pretty big part of why. So this legislation will establish the parameters for, how we manage 988 in Pennsylvania, but it also provides the department the authority to administer 988. So as it stands right now, all we can really do is plan, advise, coordinate, but as far as, issuing formal guidance, really putting concrete things down, that has to wait for the legislation. So I guess the only other thing I would say there is I would expect once this legislation is introduced and passed, then things, as far as directives from the state and guidance from the state, those things will come down much more quickly once we have that authority established and we have those parameters established through the legislation. But again, until the legislators, complete their piece of that process, there's not a whole lot that we can really put out there that's concrete. There's a question around call centers that are not in the NSPL. Are these call centers still going to exist, or what's kind of the fate of these local call centers? And I'd say first there that there's not really anything to preclude local call centers just because 988 is going live and these calls will route to the NSPL. That said, we would certainly expect that those local call centers would see less volume because next year, from everything we're told, there's going to be a pretty big national public awareness campaign around 988. So there will be few people who haven't heard of 988 and don't know that 988 is the number to call. So just by right of it being easy to remember and very publicized, we would expect less traffic, to go to those local crisis call centers. Funding wise, that would be really up to the counties or up to the call centers on how they're funded. The only thing I would note there is that, this 988 surcharge that's being discussed that we're hoping sticks through the legislation and brings revenue toward 988 services would not be able to be used for any call centers that are not in the NSPL. And that's because the federal legislation specifically limits the use of that surcharge to NSPL call centers. How can 988 funding be used? Touched on this a good bit earlier. Just kind of wanted to reiterate that because there's the call routing and then the call center services themselves, the mobile crisis services, and the stabilization. Obviously, that leaves quite a few pieces of the continuum of crisis services outside of the scope of that funding. So post-crisis services, inpatient, things like that. So I wanted to mention it because we are aware that there is all this focus and momentum toward 988, but we're certainly not forgetting about the importance or need for those other services. So while the funding mechanisms may look a little bit different over time because of 988, those are still things that we're certainly focused on and that we will continue to be supporting. Then the last one, second to last one then, is about the deadline. So it's the deadline to go live, but could it be sooner? And this is an interesting question because it really depends on the definition of going live. We've been told that all of the major mobile carriers actually already route calls to the 988 number to the NSPL. So if that's the definition of going live, then over 95% of cell phones from which you dial 988 will connect you to the NSPL. That's an interesting issue because we understand that there's additional capacity needed at the county level, at the provider level, at the call centers to handle the volume. So it's a bit of a balance. These calls are already being routed, but thankfully, due to just a lack of public awareness, and it's an intentional lack of public awareness. There's reason that 988 is not being strongly promoted at this point is because, frankly, we just need time to get things in place to handle the increased volume. So that said, we've been told as well that the National Public Awareness Campaign for 988 will begin after the July 16th, 2022 implementation date. So really, it's an interesting hodgepodge of, you know, different extents to which 988 is live at this point. But it is also confusing because July 16th, 2022, the date certainly means different things depending on, you know, from which perspective you're looking at it. So I just kind of wanted to note that 988 is already routing, but we are, you know, sensitive to the fact that we need more time to prepare for really 988 to be publicly known across the board and to see that volume increase. And then lastly, speaking of volume increases, just wanted to share a little data we got regarding potential additional call volumes. So Vibrant has 3 scenarios, and wanted to share these because even in scenario 1, the low scenario, you're seeing a 3-fold increase in calls over 5 years. So that to say that there's definitely an anticipation that we'll see a pretty substantial increase in call volumes once 988 both goes live and the public awareness campaign starts. We're also thinking in terms of services here, obviously more calls. If you have 10% that require mobile crisis response, well, you know, 10% of 13 million is a lot more than 10% of 4 million, you know, per scenario 1. So once again, just that we're looking at, we understand the need for staffing and resources related to these things. So that was all I had for the time being. I'm happy to be here, happy to have the opportunity to present today, and also happy to answer any questions, any additional questions then during the Q&A. Thank you.
Thank you so much, Dan. And I really appreciated that FAQ at the end because you answered a lot of my questions already. Okay, so I'm just gonna share my screen again. And so now I'm going to turn it over to Dr. Lisa Colton and Kate Reed from Philadelphia to talk about their 988 planning and what they're doing to make sure that their system is ready at this point, and next steps, I'm sure, for after that. So thank you so much, Dr. Lisa Colton and Kate Reed, for being here as well.
Gretchen, will we be able to ask Dan questions after the next presentation?
Yes, sorry. So we're doing Q&A all at the end. If you have a burning question, go for it. You can also type in the chat at any point. If you can't stay, I'll make sure that it's answered.
Thank you.
Yeah.
Well, thanks for having us as well. And I think we have a really great jumping off point following Dan and all the information he's given us in terms of Philadelphia and what we're trying to do to plan for 988. Can I move the slides, Gretchen? Oh, there you go. Okay, so I guess I'm going to give a little bit of background, and I know some of you, I think, who are on the call, I think we've already had these conversations. Anyway, so just as a background, our crisis system has been around for 30 years. And prior to all of the 988 events, we had anticipated beginning changes. We had been looking at sort of gaps in our system. Many of this was exacerbated around the unrest that we all experienced with George Floyd, and then at home in Philadelphia with Walter Wallace Jr. So things kind of amped up for us in conjunction with the 988 rollout. So we have been focusing on looking at the Philadelphia system internally and externally, both looking to build capacity and also to fill the gaps that were noted, that were preventing people from getting care, and that we're making the system not a trauma-informed system. So similar to what Dan was talking about, we've really been focusing on mobile teams, on the community, and also on 911. So partnering with both the communities and law enforcement in terms of strategizing ways that people can enter the behavioral health system and get help in a non-traumatic manner. So we've been looking to guide ourselves, to prioritize what we need before we roll anything out in order to be able to handle the volume that we're anticipating, and also not to make promises, certainly to people that we can't keep. So for us, for 988, we've been looking at a new technological system to support our crisis line. We have the Philadelphia Crisis Line, which is sort of the hub of our crisis system. We answer calls that come to us from 3 different avenues. We answer crisis calls for the city. We answer the suicide hotline for Lifeline. And we also do delegate calls. We are the center that provides commitment assessments, and we approve or deny warrants for patients to be taken to the crisis response centers to be evaluated. So this system is it's a long-standing system, and we could really benefit from enhanced technological support to be able to see where people are within the system and to be able to deploy mobile teams to wherever the people are in the system that need them. So part of what we're trying to do is to improve our care traffic control, and to standardize our practice amongst all of our teams. So we're looking at the technological support in the crisis center itself. We're looking to build the mobile teams in the field, along with the urgent care centers, along with our collaboration with law enforcement. We have 4 crisis response centers now. We're planning to enhance to 5, and also to utilize all of our crisis stabilization programs. Our hope is for the least restrictive interventions for people that are in the system. Okay, this is sort of kind of a restatement of the elements of our crisis system that we're hoping to enhance. It is actually in line with what Dan was talking about with the best practice toolkit from SAMHSA in terms of hoping to assist people as quickly as possible, as effectively as possible, and with least restrictions. So similar to what I was talking about, we have our 24/7 mobile teams that we're enhancing. We have crisis stabilization centers and urgent cares. We are enhancing our use of peer specialists, persons with lived experience in the communities and on our mobile teams. And then also our 911 functions. I think Kate's going to talk a little about the specifics that have to do with 911.
Yeah, and just to jump in really quickly, I mean, like Lisa had said, this sort of crisis 2.0 had been in motion for a number of years. A lot of our partnerships with the police have been in motion since, I think, like 2018. So a lot of this work was already happening and already being planned for. So before City Council approved the FY22 budget, we had already put in proposals for expansion, both of this internal capacity and external capacity. So we had, prepared expansion timelines, calculated the proposed call volume increase as best as we could to figure out, the level of call center staffing we would need to handle that volume. It allowed us to estimate the number of mobile crisis teams we needed to add to be able to handle the calls that would require an in-person response. So after the budget was passed, we had to coordinate all of these different efforts. So it's the expansion of our behavioral health crisis line staffing, it's the Philadelphia Crisis Line, PCL. So if you hear us say PCL, that's what that stands for. So is that expansion, the expansion of our embedded crisis navigators at the 911 call center, expansion of our mobile crisis teams, and then also citywide expansion of our co-responder teams with the police. So it took a ton of coordination. It's still taking a ton of coordination between all these different departments. So we're still carefully looking at these different rollouts and the timing, because it's all about timing and getting it right. I mean, we don't want the call volume to increase before we have adequate staff to not only answer the calls, but to respond to the calls and follow up as well. And we'd be happy to chat with folks in more detail after the webinar about how we sort of projected our call volume increase and how we sort of planned this strategic rollout of all of these different services. I think, and Lisa, you have to correct me if I'm wrong, but in terms of the projections, I think we national data estimates a 30 to 40% increase with 988 implementation. We also have an anticipated 20% increase from a marketing campaign. And then also we had projected, now that we have 911 calls and behavioral health calls being transferred to the crisis line, we expected that to go from like 400 a month, I think, to about like 4,000, using a lot of the data that we have. So we're going from about 5,000 calls a month to about 12,000 in the next coming months and years. So yeah.
And probably similar to other call centers, we've started to experience an increase in call volume and also in people resisting calling 911 and wanting to directly ask for behavioral health support first. So yeah, it's been a lot of work to coordinate and to understand different pathways that calls can go, and that mobile teams can be effective and be safe. So those have been some real conversations that we have and are continuing to have with all of the stakeholders.
So sorry to interrupt, but someone asked if the acronyms could be explained. Kate, I know you mentioned PCL is Philadelphia Crisis Line, but would you mind just explaining the other acronyms here before?
Yes, our field is full of acronyms. So CIRT is our Crisis Intervention Response Team. That's our co-responder team. And I'll talk a little bit about that in a minute. PCL, like I said, is the Philadelphia Crisis Line. Oh boy, CMCRT is Lisa. You want to take that one?
It's one of our mobile teams. It's a
community
mobile, yeah, crisis response team. So for our mobile teams, we have short-term teams and long-term teams. So the CMCRT are the ones that would go out to a call initially to assess the situation and complete a disposition for the client. And then if they didn't need to go to a CRC, which is a crisis response center, but instead could be maintained in the field, we have a longer term team with a different acronym that could follow them for up to 6 months while they're, to sort of help them to be connected to care.
And CRC is Crisis Response Center.
Yeah.
Next
Yeah,
one.
gotta love those acronyms.
So I guess for the mobile response teams, and I hope we're not jumping around, we kind of live this, so please redirect us if you feel like we're, leaving something out that, we're skipping over because we've thought about it so many times. But previous to this, we had some success in kind of reconfiguring our children's mobile teams. We had a recovery model that we started to utilize, and that included the two teams, the short-term and the longer team focus. We had a lot of success with the children's team, so we're recreating that with our adult teams. We divide our city into regions, and we have the crisis response centers centered in the different regions of our city, and we are enhancing our mobile crisis response to mirror that, to also be in the different regions of the city, so that the teams themselves can be community-based, can get to know the regions of the city that they are based in, their supports that are in that region, the unique challenges that might be happening in those regions, and then be able to kind of also function as within the system. So we have really 1.5 mobile crisis teams currently active in the city, which is fairly concerning with a 1.3 million population. It's a lot of work. So anyway, we have procured 2 additional teams. So we would be standing up 4 teams in the city, and each team would consist of a long-term and a short-term team. So those are our mobile crisis teams. We're actually just in the process now of completing the procurement, and then starting a learning collaborative that we'll talk about later, that's really going to help us to all standardize our care across the city. That's our goal. And then we have these co-responder teams. I don't know if you want to talk about them, Kate.
Yeah. Well, actually, if you can go to the next slide, I think that sort of explains a little bit more. So I want to talk about 2 pieces of this model. It's the 911 triage piece, and then I'll touch a little bit on the co-response piece. But there was actually an article that I read fairly recently through Crisis Now. And I don't know if folks are involved in their, they have weekly, I guess they're webinars. They call them, it's 988 Crisis Learning Community Jams. And there's like 200 to 300 people that attend. It's a lot of national organizations, state reps, and they talk about a whole host of things. They talk about national and state legislation, federal updates. I think SAMHSA representatives from SAMHSA and NAMI are there. And there's different featured speakers each week. So if you're not involved, I recommend getting involved, because there's a ton of information sharing in those meetings. But I read this article, and it's called "Why Partnering with 911 and First Responders is Crucial to the Success of 988." And they interviewed Dr. Margie Balfour from Arizona, and she was saying that, as jurisdictions build out their systems to prep for 988, we really need to do a deep dive and look at how folks enter our systems. And that really requires, like a landscape analysis of all potential diversion points. And we need to make sure that police can connect people to care easily at all of those points. And that, of course, starts with 911 and 988. And at each of these points, she's saying that, the goal is to move towards clinician-only response without law enforcement as much as possible. And there was a quote in the article from Dr. Balfour, and she said, quote, "Without a crisis system to connect to, callers will still end up with a law enforcement response, which can be stigmatizing and dangerous, and be taken to jail or the emergency room." So really, this is what we're trying to avoid. And I wanted to lay that foundation and really reiterate the importance of partnering, with our justice agencies to really successfully plan for and execute the 988 implementation. I'm sorry, my dogs are going to bark. Give me 1 second. Okay, I'm going to try to talk through their barks. So we've been planning for the implementation of this 911 triage strategy since early 2019. It's a collaboration between our police department, the Department of Behavioral Health, and also the Managing Director's Office of Criminal Justice. So there's three primary components. I'm only going to touch on two of them. The first is the implementation of a 911 call triage infrastructure. And that's really designed to better identify behavioral health crisis calls to 911. And then subsequently, that's really aimed to improve the dispatch of the variety of response teams that we are expanding based on the nature of the call or the event. So for example, CIT officers, the CERT team, mobile crisis response, et cetera. And the last piece of this strategy is the development of our crisis intervention response teams. Those are classic co-responder model where we pair a mental health professional with a CIT trained police officer, and they jointly respond to behavioral health related crisis calls and incidents. So the purpose of this topic, I want to focus on 911 triage. So we drafted a behavioral health call taker script that was implemented at 911 back in November of 2020. It's been through one revision since. I think we did the revision in April. We essentially shortened the script and we made the questions a little bit clearer for the call takers. We also implemented an enhanced training program for all 911 staff. So that includes call takers and dispatchers. And that was based on the CIT curriculum. So our CIT coordinator has been delivering the training. And I think at this point, 90% or I think 90% have been trained so far. So about a year ago, we also brought in an embedded behavioral health navigator to work on site and alongside 911 staff. And they really serve as consultants and they provide education support to the 911 staff. I know Lisa's been heavily involved in these monthly lunch and learns as well, and that's between behavioral health staff and all the 911 staff. And it's really a chance to really for folks to just hang out and build rapport and trust, which is I think a huge, it's key to this cross systems work. When our city passed the budget, at that point, we got the green light to be able to expand the role of our embedded navigators. So they will be there 24/7, 365, and then we are also widening the scope of their work. So they'll still be co-located at 911. And now they're going to be directly taking calls transferred from 911 that are behavioral health related with no public safety risk and no active crime being committed. These navigators will actually still be tied into our PCL system. So they will be crisis line employees, but they're going to receive some advanced training in the 911 call center. And what's really important for us is that they will have the ability to dispatch mobile crisis teams. We modeled this initiative off of some other really impressive jurisdictions. Two in particular are Austin and Houston, Texas. So we're revising the script again, and we're going to make it more like a decision tree. So 911 staff can quickly triage these calls to the most appropriate response. And we really hope that a lot of these calls will qualify for a direct transfer to the crisis line, and we can avoid law enforcement altogether. We have protocols already in existence for the transfer of suicide calls that are coming into 911 to the crisis line. But we're working with our police partners to revise those protocols to make it more streamlined. And then we're also expanding the types of calls that are eligible for transfer. I think a key piece of this too is the ability to transfer back to 911 if a situation becomes a safety risk and a police response is actually needed. So I think it's really important to have a close relationship with 911 and local police departments. So we're expecting increase in call volume as it is from 911. We think that's a good thing, as well as the increase in calls with 988. I think somewhere down the line, we will eventually see less behavioral health calls coming into 911. That's what we hope to see at least. And we hope that folks will start to utilize 988 more often. And just quickly to touch on our co-responders. So part of our budget included citywide co-response expansion. It pairs behavioral health clinicians with police officers, and they arrive together in the same vehicle to calls where an individual with behavioral health challenges will need support. We began the program April or May of this year, and it currently involves 4 teams. That's made up of a CIT police officer paired with a behavioral health clinician. And we also have 2 peer-based follow-up teams that help the individuals and their families connect to services in the community. Expansion of the next year will involve bringing in another provider. So we'll have 2 providers that will cover the entire 6 divisions, police divisions in our city. Operating hours 24/7, 365. And our goal is to have 6 teams operational in the city at all times, plus 4 of these follow-up teams. And I mentioned CERT expansion because we really want to see this real-time coordination between the CERT teams and our mobile crisis teams. And I think like Dr. Balfour mentioned in that article, this is another point where we can still divert folks experiencing a crisis away from the criminal justice system. So that's sort of the strategy from a police and 911 perspective, because we do know that it's like Dan said, it's going to take a lot of work together with our law enforcement partners. And Lisa, do you want to?
Yeah, just finally, really quickly, the other thing that we've initiated is to have a learning collaborative with all of the new mobile teams, including the co-responder teams. Really just like it sounds. We have 2 facilitators. One has expertise in a resolution focused model, and the second has expertise in the different communities of Philadelphia and the different needs of those communities. And so the goal is to have all of the mobile teams be trained with the same foundation, the same goals, the same strategies, potentially even to use similar assessments or parts of the assessments to be the same so that we can communicate easily. Also, then to be able to have people that have expertise with special populations come and present and become a part of this response. So to talk to people with intellectual disability, people with autism, deaf, any kind of population that may benefit from expertise, to come to this collaborative and be able to communicate, and then to have ongoing sessions amongst the mobile providers to talk about issues that they have once they're in the field, how best to resolve them, what we're still missing in the system, what needs to be fixed, how to better communicate with the other providers. So that's really the other piece that we've added for our training. I think that's it for us.
I think that's all we got.
Thank you so much, both. That was really helpful. Great to hear about all the exciting things you're working on. Okay, we have a couple of questions. Actually, first, Josh, if you're still on, I know you had a question for Dan.
Well, this is so much information. I have to get back to my question. I think it was about the surcharge, and I just want to clarify that part of that surcharge or that funding would be available to current crisis intervention services, not just the NSPL call centers.
That is correct. So I would add one word of caution with the surcharge. We fully expect it. We know that we need it, but that is something that's also tied up in the legislation. Therefore, something that is subject to change. The iterations that we've shared with our potential legislative sponsors haven't really seemed to have taken issue with the notion of a surcharge, but we've seen things kind of go off the rails during the legislative process too. So just to say that I know I spoke of the surcharge, throughout, and it's pretty much a sure thing, but just to kind of add that caveat that it's not 100% a sure thing. But as far as what would be funded through that surcharge, we're absolutely expecting that those funds would be used both for the call centers and for the mobile crisis teams and the stabilization services. What we anticipate that structure looking like is that the agreements would be kind of on the county level. So these would be mobile crisis providers contracted by the county and funded through the 988 surcharge. But there again, until the legislation goes through, that's just kind of our best guess at what that will look like.
Thank you.
Okay, we have another question for Dan, but if there are more questions, feel free to put them in the chat or just speak up after me. For Dan, at the very end, you mentioned that DHS recognizes the need for supports for localities. Can you give some insight into what those conversations have been in terms of types of supports DHS is thinking about for supporting this transition?
Just to clarify, was that on the public awareness piece or just in general?
I think it looks to me like it's in general. I don't see anything about the public awareness, so we'll go with that.
Okay. So I guess tying back to what we expect the structure to look like, a lot of the provision of services under 988 and kind of the organization will be left up to the county. So, it's not going to deviate wildly from the way, the system's structured now, where the counties, have a lot of say in kind of what's provided and through whom. I think what we're trying to get at with, looking at needs based on localities, both with the public awareness campaign and through, the CMS grant, if we end up getting that, is we recognize that there are different challenges to different places. Some places it's a matter of capacity. They just need more staff. They, are having trouble recruiting staff. Others, especially more rural areas, the issue is kind of more coverage and demand, that these services need to be in place, but they're not always necessarily, there's not going to be enough demand to have somebody out, constantly. So just looking, I think a big part of it is recognizing that all of the counties are going to be a little bit different in the challenges they're facing. So looking at all of the different approaches, as it said, through, be it the Medicaid state plan, be it funding, whatever it may be, just recognizing that all of the counties are kind of different and that we're going to have to apply some different approaches and fill some different gaps for each of those.
Thank you. And then another question for Dan. It looks like this is more just sort of a general, this person wants to just kind of understand how this happened. So it sounds like they're asking what kind of discretion jurisdictions have to make any decisions about which entity is the recipient of the 988 calls, which it sounded like there's not, but they're saying the existing National Suicide Lifeline was, that's where the 988 will go now, but it sounds like they're just curious as to whether that was like a federal requirement or if the state made that decision.
So as far as where the calls are routed and whether localities will have discretion over that, I mean, the National Suicide Prevention Lifeline call centers, excuse me, are listed specifically in the federal legislation. So 988, as it kind of came down from the feds, specifically called out these calls being routed to the National Suicide Prevention Lifeline. So as far as having discretion to, you know, choose a non-NSPL call center, that wouldn't really work. One, just because of the way the federal legislation is written. And then also that would preclude it from getting the surcharge funding, also due to the way that the federal legislation is written. So as we're going with it now, we have, you know, the existing NSPL call centers. I think there were 2 that recently came on board as well. So that's kind of what we're running with initially, but there certainly haven't been any decisions made on additional call centers joining the NSPL network at another point. So I guess that to say that there will be some flexibility there. Say there is a call center, a local crisis call center that wants to be involved in 988. I think going forward, there's nothing that would necessarily preclude them from joining the NSPL network and then being involved in 988 that way. But just due to the way that the program and the funding structure is set up from the federal legislation, you know, those call centers would have to be in the NSPL to participate.
Okay, thank you. That was really helpful. And Dan, I know you mentioned the SAMHSA's best practice toolkit. I don't think I have that in my resources slide because I think a lot of people have that. But are there any other, and Kate, you recommended the Learning Community Jam. I have the Crisis Now link in there, but not the link to the actual jam. So I'll share that with everybody. But do either of you have any other resources that you would recommend people take a look at, or where they could find out updates like as this process continues about 988? And it's okay if not, because you already mentioned some.
So I was trying to think. Well, I guess first of all, I would echo regarding the crisis jam. I'm involved in that as well. I typically attend those when I can, and it is very informative and helpful. So I'd also recommend that. I was trying to think because I know Vibrant, who is the National 988 administrator, they had quite a few resources out there. Some really good, you know, just very sort of simple, topical 1-2 page things that were really helpful in you know, getting partners to kind of understand the gist of 988. But I know they changed some of the access and structure to some of the content they had. So I was kind of hesitating with that because I don't know necessarily what's still publicly available or not. But I would, you know, I guess it wouldn't hurt to check Vibrant Emotional Health 988, just do a search for that, since they are the national administrator and they do have some information out there that's pretty helpful.
Great, thank you. And I'm not seeing any more questions, but I just had one for Kate and Dr. Colton, just because I know a couple of counties have been, that I've talked to, have been exploring embedding a behavioral health person in 911 dispatch. And I think you've connected with some of those counties already, but for any others, I know that you talked a little bit about that and how folks in 911 dispatch are receiving training, CIT training, I think, and you're working on this decision tree and everything. I was just curious as to what you've seen, if anything, any changes you've seen so far since those individuals have been in there. And just, I guess, what you would say, any advice for anyone that's thinking about doing the same thing in their jurisdiction.
So I know, Lisa, do you want to speak to, I mean, I think there's been an increase in calls that have been transferred to the crisis line, even though it's not part of the police protocol. Well, let me just say this, our police department manages 911. So all of the protocols, processes have to be approved by our police commissioner. So that that can get a little bit tricky, but I know we have definitely seen an increase in non-suicidal calls over to the crisis line thus far. I think a lot of what we're seeing that's not sort of in the numbers is a very slow culture shift. And really, I think having the navigators there, like working next to these individuals and being able to just ask questions. I think it's hard to describe the benefit, but like you just see this cultural and this attitude change.
Well, so also for the 911 operators and dispatchers, they're getting a new understanding of the crisis system, of opportunities for callers, right? So it's almost opening up, you know, I mean, they're police driven and they run by the police protocol. And so we're inviting them in to consider something else. And so that's been initially, I think it was met with a lot of resistance. I think that they felt like this is not our job. So we've been there to answer questions, but then also to offer, the behavioral health navigators can also offer support. So if there's a difficult call that they participate in, they have the opportunity to talk to a behavioral health person on site, you know, and you can imagine the trauma that they themselves might experience just being a part of the 911 call system. So I think that we're forging a really nice alliance, and the hope is that will also continue and help to improve, you know, the coordination between both systems, like the respect for each system. It's hard earned.
I have a question, Gretchen.
Yeah, go ahead, Josh.
So I'd be interested in the contact information for CIT coordinator who provided the training to the 911 staff. We are in conversations with our 911 and I think we even have a training scheduled, but it would be good to kind of see what was on your agenda to see if we're kind of hitting the right points. And then we've also had conversations with our 911, and I'd be very interested in seeing your job description for the behavioral health navigator and the script, if you're willing to share it, because they are extremely nervous about providing any level of screening of calls. They want to send the police out to every single address that calls, and there doesn't seem to be much room in between. So if you have a good, question tree, and they're familiar with question trees, so if you have something like that you could share, that would be great. And then in our area, we do not have behavioral health urgent care centers. If you just kind of briefly tell us what that is.
Sure. So we currently have a children's urgent care center for behavioral health, and we're looking to add an adult one. It's really like a general urgent care center, a walk-in center, where somebody can come for an evaluation. So it would be somebody who's clearly voluntary, and they would walk in and have an evaluation and be connected to services. So instead of having to go to a crisis response center, which is a locked facility, right? It's much more of like a walk-in outpatient center where they can be kept in terms of they can have continued outpatient follow-up until they can secure an appointment. There's a nurse practitioner who can conduct some medical, address some medical issues if that's part of the presentation. And then also either a psychiatrist on staff or on call who can be directive in terms of potential medication interventions, just for the interim to get someone connected to an outpatient level of care.
So does that include some level of case management to make referrals and
For
do?
sure. Yeah, absolutely. Absolutely.
Who's your provider for that?
For the children, it's called PATH.
Can I ask a question about funding for that? Because that's an area that we've also looked at in the past. So you have to fund individual services though, right? Like if it's a psychiatric eval for medication, that's an individual service so how do you get that to work?
You mean in terms of the funding for the urgent care center, or for them to get paid for the service?
Yes, for the urgent care center. How does the provider make that work in terms of funding?
I believe that it's funded through CBH, that is our community behavioral health service, but I would actually want to look into it and then I can let you know. If you'd like more specifically, I want to make sure I'm right in what I think.
I appreciate that.
Do you think, Pam, you could share your contact information? Maybe in the chat or?
Absolutely. I'll put that information in the chat.
Okay, great. And then I can reach out to you. Thanks.
Yeah, I was going to say, Josh, if you also want to put your information in the chat, and I'll send you some of those materials, or I can send them to Gretchen, and if anybody wants to take a look at them. I think our behavioral health script is public. It's been shared publicly. I don't know if I think that might have been by accident, but it has been shared publicly. So I'd be happy to share that again. Great.
Thank you.
Any other questions? Okay.
So I guess I have just a general question. I'm sorry, I don't know what time this was supposed to end.
Oh, no, it goes till 12:30. Go ahead.
The National Suicide Prevention Lifeline has historically not really been, like their primary job hasn't been triaging for traditional crisis intervention services really. So I'm just wondering how that service, how the National Lifeline is changing to be part of this new role, which is, the direct 911 for behavioral health is what it's sounding like. Are there structural changes or programmatic changes that just kind of support this new role? Because it's starting to sound like it could end up being almost like a filter for our traditional crisis intervention services. Their numbers a lot easier to remember than ours.
So I've heard of some changes in the training and the guidelines at the NSPL level, but aside from that, I mean, that's kind of outside of the scope of what we're doing as far as the regulation and the 988 legislation. And actually, just as sort of a related but interesting aside, we can't actually technically adopt the NSPL guidelines in the state legislation because that would be delegating our authority. So, yeah, it's a little bit of a tricky balance there. But just to say that I have heard mentions of updates to the training and the guidelines reflecting the changes that are coming about through 988. So I couldn't really speak to the extent to which they're updating and adapting in anticipation of 988, but I know that they're at least doing something.
Let's see. Any more questions? Okay. I think those were all the questions. Thank you all so much. Just gonna provide some resources. And as I said, we'll send the recording out and the slides. I have the link to the Crisis Now website. You can find the 988 Learning Community Jam that Kate mentioned there, but I'll send a specific link to that, to this group as well. And then I just have some other resources here that might be helpful. There's a brief from the Justice Center on building comprehensive and coordinated crisis systems. There's an FAQ from Vibrant. There's also a funding announcement that's open right now from PCCD that might be relevant to this group because it's specific to expanding or developing new crisis intervention initiatives or programs or pretrial diversion. So that's open until the 24th. And I can also share the SAMHSA's best practice toolkit that Dan mentioned in case anyone doesn't have that. Just for some upcoming TA Center events, we have another crisis focused event. This will be a virtual training on Tuesday, the 28th. The link is here, so they'll be within the slides, but I'll send this out again to everyone. From 11 to 1, we're featuring Allegheny. So this, I think, will kind of be, since Philadelphia talked about their work to expand their crisis system and ensure it's integrated and ready for 988 and everything. I think this conversation will kind of be a continuation of that. We'll be featuring Allegheny County, Pennsylvania, to speak about the pretty large planning process that they went through recently to enhance their crisis and prevention systems. And I think they're planning to talk a little bit about 988 as well. And then we'll also be having one of our Stepping Up Innovator counties outside of Pennsylvania, Dallas County, Iowa, to talk about just some of their work in this area. And there will also be a bit of a housing element. Someone from our housing team at the Justice Center, Thomas Coyne, will speak about best practices in leveraging housing as a platform for crisis diversion and stabilization. And we'll have some time at the end for breakout group discussion, which we've heard some counties enjoy. So looking forward to that. As always, please let me know if you have any feedback about the events or if you have any ideas for webinar or training topics that would be helpful in the future or type of TA. If you're not on my listserv for the TA Center, please feel free to email me or write in the chat and I can add you. And then this is not through the TA Center, but it's an event that the Justice Center is putting on that this group might be interested in. It's a national virtual conference. The Justice Center is putting it on in partnership with the Bureau of Justice Assistance, the U.S. Department of Justice, and University of Cincinnati. And it's focused on exploring innovative community responder models and also just how jurisdictions are building comprehensive crisis systems that ensure that emergency calls receive the appropriate response, whatever that might be. So I think that's going to be a really great event. There was registration for individuals and for teams. I think the team registration is closed, but individual is still open. So the link is there and I can share that in an email as well. So we know a lot was covered today and this is a new confusing area. Everyone is in different places in their planning, but hopefully this webinar helped your county, wherever you are, in thinking about how you want to move forward next to prepare for all these changes. Please feel free to reach out if any questions. I know some contact information was shared in the chat, but I can also connect you via email. So just let me know if that's easier. And if you have any other questions for the presenters, you can send those along. So I think that's it. Thank you so much to the presenters for your wonderful presentations, and thank you all for attending. Thanks to PCCD and Magic and UMSAS one more time. Hope this has been helpful, and I hope everyone has a great rest of their day.
Thank you, Gretchen.
Yeah.
Thanks,
Thank
everyone.
you.
Thank you.